they have made our processed foods more addictive and really hijacks our brain when it comes to the effect of natural and artificial flavoring and how it causes our body to crave more of that, producing a sense of not feeling satiated. So we keep eating more, and our bodies are really looking for something in those processed foods that we're eating, but we're not getting it, right? So that's just one example how corporations have had a significant effect on our food. And then we look at how
I want to thank all our viewers today for joining us as we continue this series of dealing with the state of chronic healthcare in America today and unraveling the mysteries of chronic illness. Today, I'm joined by Dr. Julie Heyrman from our clinic in Wisconsin for Forum Health. And today we're going to be focusing on the topic that's going to be perhaps a little bit sticky for some because we're going to be dealing in a way with some inconvenient truths. But we're going to be focusing in today's episode on investigating some of the ways that corporate interests shape our health policies and regulations. We're going to be exploring efforts and ways to reduce the corporate control over some of our government, including some of our three-letter agencies like the FDA, the CDC, the NIH. And we're also going to be discussing some about the importance of independent research and advocacy and how that can shape public health. So some of this series, which will include a number of episodes, was inspired by the issues kind of evolving around our current national elections coming up here in just 11 days from when we're recording this episode. But some of the candidates that have been running for office in this cycle have made healthcare, especially as it applies to chronic illness, some of the main features of their platforms. And I was really interested to see just, I think yesterday, that in a poll where they asked Americans what was their most important issue for this year's campaigns and elections, the number one was inflation and the economy. The number two was free speech and censorship. But number three, listed at about 60%, was healthcare and chronic illness. So clearly, the things that we're going to be talking about today are high on the list of concerns of many Americans. And so I think it's especially timely, that we do this. And I want to remind everybody that hopefully if you get something out of these episodes, that you take the time to follow us so that you can be reminded of new recordings, and also that you share with family and friends. And we're also very interested to get feedback from you, the viewer, about your take on this. Do you agree? Do you have questions? Are there specific episodes or topics that you'd particularly like us to discuss? Now, some of these episodes are going to be kind of public policy, and some are going to be much more clinical, where we talk about the medical aspects and the exact aspects that we as providers are a bit more able to give. But having said that, all of the episodes will include some of each. And so I'm going to just start off by giving you a very short bio about me, and then I'm going to let Dr. Julie introduce herself, and then we'll get into a series of questions and answers regarding our topic for today. So as I've said before in other videos, I'm a provider that's been offering consultation in environmental medicine, which basically means that I help patients or individuals or families that have symptoms of chronic illness that tracks back to cumulative exposure to a wide variety of environmental threats and toxins and even stresses. and I practice in a telehealth regard here in Austin, Texas. My background earlier than that was initially I was trained as a traditional ear, nose, and throat, head and neck surgeon, and I left that field in about the 90s due to frustration that I had not really been trained to seek out root causes for illness, but instead had mostly been taught to focus more on just finding a drug or a surgery that would kind of help alleviate some of the symptoms that my patients were coming in with. So that's my background. Dr. Julie, why don't you tell us a little bit about your personal story as far as how you got to where you are today?
Thank you, Dr. Taylor. Um, I am really happy to be here with you. So thank you for the invitation. Um, I started with Farm Health in January. I'm coming from practicing traditional primary care for the over 22 years. And in that capacity, I saw a large population of patients with chronic illness, and over the years was really um, focused on diabetes and hypertension for some of those people. Um, I attended a nutrition and health conference put on by Dr. Weil and the Arizona Center of Integrative Medicine, and it was life-changing to say the least. It was an amazing conference on nutrition and how that applies to our health. And from there, it was a very clear move to do integrative medicine training and fellowship, which really brought the joy back to my practice. So I've been practicing integrative medicine for several years prior to coming to Forum Health. And also in that capacity, I had a very successful weight management program as well. So I was delighted to be able to help people improve their health and get off the multitude of medications that they were taking for various symptoms. Uh, Really, what amounted to is diet and lifestyle caused them to have chronic disease requiring multiple medications. And they were able to get off of those medications with the programs that we had established.
Great. Yeah, it's always amazing to me all the different backgrounds that we see providers coming from as they enter this wonderful field of functional or integrative or holistic medicine, however you call it. But most of us come from a traditional background of training, but then it's out of frustration that often we migrate into this root cause approach to medicine and more preventative approach to medicine that kind of gets away from some of the pharmacological cover-ups or drug cover-ups that we use. But let's start off by letting me ask you if you could comment on the relationship of American government today and corporate interest in the state of our health. Do you think it's a problem as regards our epidemic of increasing chronic illness? And if so, what are some of the ways that it does that?
I do agree that the American government and corporate interests have had a significant influence on the state of health and policies that affect the uh, American health over the years. We saw corporations like the Pepsi Fund organization that regulates insurance funding and guidelines for diabetes care and insurance coverage for medications. These special interest groups play a significant role in shaping the healthcare policy at the federal, state, and local levels. We saw food industry influences not only for government regulations, but also healthcare agencies. Um, the food corporations would fund research and promoted the research to support their special interests. So another good example was how the cigarette companies, as as the government was cracking down more on them and showing how cigarettes truly were not healthy for people, and contributed not only to lung cancer but birth defects. The people who worked for those organizations and the corporations themselves purchased food manufacturing companies, and uh, the employees with the research for cigarettes and how they made those so addictive have shifted to food science, making foods more addictive. Which a great slogan and example is Lay's potato chips. You can't eat just one, right?
Yeah,
They have
exactly.
made our processed foods more addictive and really hijacks our brain when it comes to the effect of natural and artificial flavoring and how it causes our body to crave more of that, producing a sense of not feeling satiated. So we keep eating more, and our bodies are really looking for something in those processed foods that we're eating, but we're not getting it, right? So that's just one example how corporations have had a significant effect on our food. And then we look at how the research is also being affected and how these corporations um, put pressure on medical schools. When I went to medical school, I had very minimal training in nutrition and its effect on health. Minimal. Um, Maybe a couple weeks, if I can, that I recall. So, um, I think also the pharmaceutical agencies have a significant hold over medical schools and the training that we receive in med school is so focused on medications being the key to treating the disease as opposed to finding the root cause of disease, and helping people change their lifestyle. It's really fascinating how the insurance companies will not pay for health coaching and nutrition counseling for our patients unless they have a specific diagnosis of diabetes.
I want to tease that out. That's an excellent answer. It seems to me like what we're talking about here is corporate America, whether it be the big food companies or the big pharmacy companies, that they're all pretty much publicly traded companies and they're all driven by the profit motive. So it seems like a lot of this boils down to follow the money, when we talk about these issues today. And basically, it was interesting that you said that if you look back on the issue of tobacco and cigarettes and their harm to us, and in fact, at the beginning, for years, it was said, "Oh, there's nothing wrong with smoking. I mean, it's healthy." I mean, if you look at World War II, they put cigarettes in the K rations of our soldiers, and for years, all of the scientists, quote scientists, in the tobacco industry and the lobbyists in the tobacco industry, would just come up over and over again with statements that they said were scientifically validated, that there was no problem with smoking or the effects of tobacco. And then the government stepped up and said, wait a minute, this is not true. The government representing the American people for once said, no, this is something that's not right. It's costing us money because of more cancer, more birth defects, and all of the different ways that tobacco affects our health. We're not going to really allow that. and so there was this big battle over actually quite a few years. And this was actually years that I was actually a professional. So I'm pretty have seen this. Well, the bottom line was ultimately now it's pretty much common knowledge. One of the main things we tell our patients is, well, you shouldn't smoke, you shouldn't use tobacco. It's bad for you. It's going to contribute to chronic illness. So what did the big industries do? They shifted gears. Said, okay, you caught us with the tobacco. Let's focus instead on how you eat, you know. And so that's kind of where we are today. There's really not that many big food companies when you really look at it, maybe less than 20, perhaps only a dozen, that,
Mhm.
and many of them are basically owned in large part by the companies that would at one time were our tobacco companies. And again, it's just a matter of following the money. But now it's all the many ways that we're going to be discussing. And you mentioned so many examples of how the profit motive in the big food area now basically is influencing, our government policies and the things that happen every day that shape our care. The complete, or not almost complete, I guess you could say, lack of insurance funding for root cause and preventative medicine, the lack of training in our medical institutions for how we as providers can be good at understanding root causes and how we can practice more preventative care. So it runs pretty deep, but I do think following the money is really often what it boils down to.
Great. Yeah. So my question for you, Dr. Taylor, is in light of President Eisenhower's 1961 warning about the military-industrial complex, could we say that America today has developed a healthcare industrial complex?
Yeah, I don't think everybody maybe is aware of this whole concept of military industrial complex, but just some quick history that President Eisenhower, right before he left office in 1961, I believe it was, before he handed off to John Kennedy, he did give a very good speech to the American people in which he said that from his perspective as having been general in commanding general during World War II and then as president, that he was seeing this complex or this affiliation between the government and these big military companies that provided our arms and ammunitions and bombs. And what he was seeing was that if we weren't careful, there was beginning to be sort of a cross fertilization that was going to end up impacting our daily lives and ultimately contributing to things like forever wars and maybe wars that never needed to happen, just so that these companies that make arms and ammunition could see their profits increase. So I think we know that now, and we talk a lot about military industrial complex, but what we're seeing more lately is the fact that there's in fact something very similar that we could call the medical industrial complex. But it's kind of what we're talking about right now with these issues of big food and big pharma, that there's this cross fertilization between the elements of our American government, including these three-letter agencies that we'll talk a little more about. Because most of these three-letter agencies, when you look at them, they're actually non-elected, non-appointed positions for the most part. And many of them are lifetime positions that once the people get into these levels of these agencies, they just stay and stay and stay. And they really don't have any checks and balances on them. So yeah, there's definitely a medical industrial complex now, and it's definitely playing a huge role. And I think one of the things we want to focus on in this series is not just state the problems and not just point up the points and issues of the situations that exist, but even think about a little bit of what can we as Americans do about this. And I think there's a lot of things we can do. Certainly, it starts with just an awareness. And that's one of the things that we're trying to provide with the series, is that people understand what we're up against, where are the problems, where are the pitfalls that have contributed to this, but then also think about, well, what can I do as an individual? And so, yeah, we can definitely self-educate. We can also not be afraid to share what we learn with friends, family, coworkers, because it helps if we're all educated, not just a few of us. Because honestly, at the same time as we educate ourselves in some of these non-traditional ways, I would have to say that because of things that have occurred in the mainstream media, there's a certain amount of information that comes out that would prevent us from knowing some of these things and allow us to think that they were nothing more than conspiracy theories. So, yeah, as we learn things, I think it's very valuable that we share. The other thing I would say is we do still have elected officials in in our local governments, even in our school boards, in our city councils, and it goes right on up to our states, our state elected officials, and then ultimately our federal elected officials. But I think it kind of behooves us to really pay attention when we cast our ballots and when we support the various candidates that are running for public office, that we be aware of where they stand on many of these issues. I mean, we live in a democracy, and that means that the government works for us. It's we, the people. It's not the other way around. So I think it kind of behooves us as individuals to know who we're choosing to represent us, and that we do more that we can to hold them accountable for that, because there's many reasons to believe that once people get elected, they end up being exposed to a whole bunch of pressures relative to this medical industrial complex and the military industrial complex and other ways. So it can be difficult, but I think it's very important that people get comfortable learning the different ways they can hold their elected officials accountable. You know, whether that's going out and meeting with them, or whether it's emailing them, or whether it's participating in polls. There's just lots of different ways that we can do that. I think it's also important, like you were saying, that we encourage our government through the policies that they make to try to look at both sides of issues. You know, we were talking about the some of the scientific studies that are done these days, many of them paid for by these companies that are ultimately designed to come up with facts and figures that support the profit motives of these big companies. And I think that we need to try to help it be balanced, so that there's studies that look at both sides and truly try to determine whether these policies are good for us as individuals. So, yeah, do you have any thoughts on that, as far as ways that you think people ought to be looking at the problem, and ways that they might be able to be optimistic about it?
I think really looking at how these policies are directly affecting them and their own health and the health of their family or friends and coworkers. And they really have to be their own advocate, and they have to do their research and, have that connection or contact with their government officials, whether that be a letter. I really like your suggestion of meeting in person, because then you have their attention. When you send an email or a letter, you question, did they even get it? Right? That's something that is always on my mind. You get a form letter back saying, thank you, right? So you kind of wonder who's actually on the other end receiving a letter. But when you meet with them in person, that's entirely different. And they are held accountable to us. We put them in office. So I think we should be able to request an audience. Um, are meeting with those who we elect.
Yeah, and the other thing, I've been learning more and more about the role of the administrative staff of our
Mhm.
elected officials, and that a lot of times it's a little easier maybe to get the ear of an aide or a secretary or an assistant, and then that can sometimes shape policy, so that these people are more representative or more accountable for us. I wonder if we could dive in a little bit more and you could maybe tell us some other ways that the corporate interests are actually affecting policies and regulations at the government level. I know there's many.
So I find this interesting, and the more I've become aware of how what lobbyists do. So first, corporate interests influence health policies and regulations at a government level, primarily through the people who lobby for those companies or industries, directly engaging with the lawmakers to advocate for policies that are going to benefit their business, not the health of the American population. So often they have campaign contributions, they fund research, they provide expert testimony, which can significantly shape the legislative process and impact regulations related to drug pricing, medical device approval, and healthcare coverage. So, some of the key ways that the corporate interests influence health policy is number one, through lobbying. The professional lobbyists directly communicating with our legislative officials, um, the campaign contributions, a mind-boggling amount of money is being funded and donated to political campaigns just to gain access and influence those elected officials, which should be criminal. It is, only serving those corporations, not the American public. So we really have to look at the grassroots organizations that mobilize public support for specific policies through advertising, grassroots activism, and public relation efforts. When we look at our children's lunch programs, how are those programs being influenced by these corporations that make processed foods, right? And they are lobbying to have um, junk food in the vending machines, um, that we are seeing such a negative impact on the health of our children, that we're seeing increased rates of morbid obesity and type 2 diabetes. We see children being diagnosed with attention deficit disorder because they can't sit still in a classroom. And yet, you look at what they're getting for their breakfast program and their lunch program that are being funded. Um, and those foods have artificial flavorings, natural flavorings, which really aren't natural. Um, and we'll get into labeling and how they change, how they change um, descriptions on the food labels as another piece that only supports those food corporations, right? Um, but the food colorings, the sugar, all have a negative impact on our children and their behavior. If you look at other countries, France, Canada, the European countries, they ban a lot of the products that we allow in our food here in America. Why is
If
America
you could,
not looking out for our children, our public, And why are they allowing these chemicals to be in our food?
You mean those chemicals that basically generate profit for these companies that synthesize all these chemicals? Yeah, again, following the money. But I was wondering
Mhm.
if you saw recently, I think it was about a month or so ago, that Senator Ron Johnson in Washington organized a one-day hearing where he invited a bunch of influencers in the area of chronic health and disease, including Bobby Kennedy Jr. But one of the people that spoke there, and I would highly recommend that people take a look at some of those speeches that were given. They're short. One of them was a gal named Vannie Hari, I believe is her name, and she was talking about the difference between the labels of ingredients on Fruit Loops in here
Mhm.
in the United States versus the Fruit Loops in Canada. And they actually demonstrated by looking at the coloration in the plastic bag of the difference between the two products. Well, anyway, it's clear that many of the ingredients in the Fruit Loops of America are actually quite toxic and have been many of them shown to contribute directly to a lot of the things you mentioned, like ADD and focus and poor scholastic performance and obesity and diabetes and many other things. But anyway, one of the things that she did was she organized a petition asking Kellogg's, the manufacturer of the Fruit Loops, uh, to look into justifying many of these ingredients and seeing why they really had to be there. So it wasn't long after that she took 400,000 petition signatures to Kellogg's. And as I understand it, and maybe the viewers would correct me if I'm wrong, but Kellogg's pretty much just turned their back and just refused to even accept or acknowledge these petitions. And I think that even more recently, I have seen some things in my social media channels suggesting that they're trying to organize a boycott of Kellogg's. So this is just one example of things that we can do as individuals to force accountability, across the board when we talk about this medical industrial complex. And going back to what you said about the role of lobbyists and the role of campaign contributions, one of the things I think we all need to know is, especially at the federal level, the amount of dollars these days that these politicians need to try to run for office, to try to be elected, it's mind-boggling, truly is. I mean, it often for Senate campaigns is can be even in the tens of millions of dollars. And we're talking about how can we as individuals, with our time and our education and our financial abilities, how can we compete, with the way that these groups of lobbyists that are funded, heavily funded by these corporations based off of the profits that they have in their coffers, how can we really compete? And I think, as you said, a lot of times it's going to boil down to laws. I think you mentioned that in your mind, and I agree completely. Some of the way these things are set up is truly criminal. And I think until we change those rules and laws and then enforce them, it's going to be difficult to make a difference. But just in terms of the lobbyists, let me ask you to tell us a little bit about your understanding of the way that elected officials often end up after their time in office of being lobbyists or having positions at the upper levels of the executive suite of many of these corporations that we're talking about.
Thank you. Yeah, it's really surprising to me when I started looking into this more, how the lobbyists working with the government officials associated with these organizations then will get recycled into maybe working for governmental officials campaign or his administrative staff. So they are going back and forth, right? Government officials or people who are on their administrative staff who have been very instrumental in guiding those elected officials to voting in a particular way. And then those people now are surprisingly working for these big corporations on boards or in lucrative positions where you question what was their training that would qualify them for those positions. And we see that in many different areas in government and lobbyists, not just as it relates to the food companies, but even big oil, for example. So, and some of these big tech companies as well. So, um, yeah, it's interesting how there seems to be this revolving door where they can shift back and forth, and they are uh, the government officials are coming in with kind of normal, average income, right? But then while they're in office, somehow they are making large sums of money, and their income is dramatically higher than what you would expect just for being in that role, whether it be in Congress or Senate. Um, yes, they get paid well by us, but I think they're also being funded in other ways.
Yeah, I know I like to take advantage of listening to books on recorded books when I'm driving and just messing around. And one of the books I read or listened to recently was written by a retiring representative from Colorado, a guy named Ken Buck. And he wrote a book, and I may not quote the title exactly, but it's basically Draining the Swamp, Why It's Harder Than You Think. And in his book, he talks about from the very first day he got elected, and he goes into a little bit of why he decided to run for office, which was basically because he wanted to support the people. He wanted to be a representative for the people that elected him. But as soon as he got to Washington, D.C., it became really obvious to him very quickly that the people more senior to him, that were elected more senior to him, were beginning to immediately put this kind of undesirable influence, especially on these younger representatives, as far as how they had to vote. And, what could be a better lobbyist for our government than to take a senior retired senator or representative that now works for one of these big companies and has a full-time job going back to Washington and talking to the people that used to be his colleagues in office and influence them in the name of these big organizations. But yeah, Buck pointed, many examples of how the need for campaign dollars was basically influencing these representatives and senators and influencing the way they were voting on legislation. And as you mentioned, there could be and there needs to be laws that are on the books and enforced that prevent some of the ways that these unhealthy relationships are nurtured and existing. And I know I've seen in my lifetime professionally that there have been many instances where some of these legislative agendas, initiatives were brought forward, but a lot of times it's been very difficult because again, there's a lot of lobbying against it, and basically you're asking for the representatives that would benefit from the existing statutes to change them in ways that would not be beneficial for them. It's kind of like, why is it that we allow our elected officials to vote their own salaries? just one, for instance. We could talk about many others where there's conflict of interest. But yeah, it seems to me like it's been very difficult for our representatives to enact laws and then those laws be enforced through the courts in ways that would actually change some of the way these unhealthy situations exist.
Exactly. Yeah, it's very clear, the conflict of interest with the corporate interest prioritizing process, when the corporate interests prioritize profit over public health and potentially leading to the policies that favor industry needs over patient needs. And there's just such a lack of transparency um, when it comes to the complexity of lobbying and campaign finance, making it very difficult to track really the full extent of the corporate influence on those who create healthcare policy, and then also enforcing those policies and laws that do regulate them, because there are regulations there, but who's enforcing them?
Exactly. I know
Yeah.
that just in this election cycle, the times that I have gone to make individual contributions, I mean, they always ask me how much have I donated? And there's obviously statutes that have been set up to regulate that. Although at the same time, it seems like there's many examples of where either individuals or political action committees or corporations, or even in some cases, foreign agencies, have been able to donate very large sums of money that basically eclipse anything that you or me could give and donate that would cause
Yeah.
influence. So I think, like you said, the statutes that exist, and there are some that exist, they do have to be enforced. And there are ways that people are trying to get around them. And I think this even goes to, it's probably, we don't want to discuss it really, but even for the idea of influence on our election system and voter system, especially as it applies to outside of our country. But yeah, again, there are laws, and they need to be enforced.
Yeah, exactly. Um, And, I'd just like to kind of shift gears a little bit here. And, we do have governmental agencies that are supposed to provide oversight and regulations, and they are supposed to have the American public and their health at the forefront. But like the FDA, the CDC, the NIH, and World Health Organization, um, in your mind, what role do you feel they play in the state of chronic illness in America today?
Yeah, I mean, I think I've been around too long, but you're exactly right. These agencies, when they were initially set up and when the vision and mission for them was created, it was to act as a way that they could protect us, we the people, and that they could be watchdogs over this whole issue of medical industrial or military industrial or whatever. But over time, and there's many ways it's happened, they've actually been captured. So unfortunately, just if we looked at say the CDC, for example, that so many of those lifers in that organization are actually basically captured by the companies that they're supposed to be overseeing. And there's ways that, again, if we follow the money, that we can see that there's influence, typically financial. Although I will even go as far as to say that we do know that there are other ways that people can be influenced. And some of it even involves, I'm just going to throw it out there, blackmail. There's ways that people can have skeletons in their closets, that if somebody else knows about those skeletons, they can, dangle the threat of exposure of some of those skeletons. And I think that's a real big issue. But in the case of the CDC, I mean, we are seeing examples of how the rulings that they make and the way that they influence not only the way you and I as providers can provide care, um, it becomes pretty obvious that a lot of times it's not the interest of the people that's influencing the edicts and the regulations and the interpretation of regulations that they're putting out. I think just one very small example, and I know this is going to probably create some comments, but let's just look for a minute at the drug ivermectin. And ivermectin is actually a drug that's on the list of about 30 some odd drugs that the World Health Organization lists as being of major impact to the world. And ivermectin, just quick background on it, was developed through research in the late 70s, early 80s, as a way to fight parasites, worms. And after it was discovered, one disease in particular, river blindness, which was seen a lot in Africa and parts of Asia, that was basically caused by a parasite that affected the cornea and caused blindness. But once ivermectin came to market and was shown to be safe and effective, this river blindness was like 99% gone. And so it was a very effective drug, and that's how it got on that list of the World Health Organization. Well, fast forward to 2020, and here we have this new virus that's never been seen before. And all of a sudden, there's all kinds of problems around it. People ended up dying, people ended up in the intensive care unit. And people around the world start looking at ways to try to combat it. Well, lo and behold, some people in other parts of the world thought, well, let's try some of these other modalities that maybe we haven't tried yet. Ivermectin was one of those. And sure enough, when it was used, it was found to be effective. And now we know that ivermectin has many other properties besides just killing worms, that it's actually been shown to have antiviral properties. And now we even know that it's useful in many forms of cancer as an anti-cancer drug. But basically, the CDC and some of the other organizations in their wisdom pretty much put out edicts that American providers were not to use it, that it was unsafe, it was unproven, and that there were other drugs, typically new prescription drugs, that had been brought to the market to deal with the issue. And there was even examples of pharmacies that were prosecuted or otherwise persecuted for making the drugs available for other uses besides just killing worms. And then there were providers that in cases were, again, they were chastised or otherwise persecuted when they tried to recommend these kinds of treatments to their patient. And that's just one drug. That's just the ivermectin issue. But it's actually many, and that's actually just the CDC. But we have other examples from these other agencies as well that we could spend probably half a day going through some of the other many examples where the NIH or the WHO or the agricultural, or the Department of Justice, how they have basically, used ways to cause things to happen that are directly opposed to the benefits of we the people. And basically it boils down to ways that end up causing money to flow into the coffers of these big companies.
Yeah. Yeah, it's I think over the last 4 years, and certainly with the pandemic, a lot has come to light for the populace on how interrelated these government agencies really are, um, and um, how they feed into each other, right? As well as um, how they are so tied to big pharma. Um, and I think for anybody paying attention, it was fairly obvious the conflict of interests that existed. Yeah.
Yeah, and so I'd like us to discuss and maybe for you to give us some ideas a little bit. If we look just specifically at the whole idea of lobbying, and just for instance, I've been practicing for many years, and a lot of my career was in a traditional role. But we were influenced often by drug reps, people that would come to our office and try to encourage us to prescribe a certain drug for a certain condition. And over the years, since I've been practicing, I've seen the government come out with a lot of rules that impacted the way that these drug companies could try to induce the individual providers. You know, I remember back at right after medical school, one of my more senior doctors, I know that he was actually given opportunities to go on Caribbean cruises if he would utilize certain drugs or devices. Most of that now has all stopped. I mean, basically, if a drug company gives a provider a ballpoint pen, that's about the extent. Or maybe they can offer a meal at a conference if they require the providers to sit through an educational 30-minute educational presentation or something of that nature. But there's many other ways that the lobbyists can get around some of these things in terms of the influence back to the Congress and back to the Senate. I mean, can we try to bring new legislation that's going to impact the way lobbyists right now influence our elected officials in ways that are not supportive of the American people? What can we do? What would be some of the things we can do? Not only enact new legislation, but even to enforce existing statutes.
I think definitely, with our current voting, that is just one way that people are going to be sending a message to our elected officials. The other is, yes, writing letters. Also being more involved in grassroots organizations and groups, starting at the local level, with your local government, um, county and state government officials, and then that is going to then feed back to the upper levels of the government officials. I think that they really need to be supporting some of the laws that already exist.
I think a little bit, or I actually think a lot about the new aspects of social media and the many new ways that Americans are getting their information every day. If you go back even 15 years ago, most of what we learned as Americans, we either learned from our newspapers or our TV news, sometimes radio news. But now that we look back on it, and now that we have all these other alternative, non-traditional sources of information sharing that have come about as a result of the internet, particularly, and computers, it's just amazing the way that all of a sudden people are beginning to say, wait a minute, all these things that we were told and that we read about, and you got to believe what you read. You got to believe what you see on the 5 o'clock news. And in fact, now people, if anything, are saying, in the majority, that they don't trust it, that they realize that there's a lot of what we're given that's just frankly not true. And so now we're being given alternative information sources that are examining these inconvenient truths that we talk about. And I, for one, am really gratified by that, because I think for me as an individual, it has really changed my beliefs. Not that I didn't already have suspicions, even going back to my time in medical school, that I was seeing that there were these conflicts of interest, and there were these ways that big business was, affecting our care decisions in ways that weren't benefiting people. I mean, even going back to the whole tobacco issue that we talked about earlier today. But I think that now I'm beginning to be very thankful for all the many ways that I can be exposed to truths from individuals. And as you mentioned, there's actually quite a few organizations that we as individuals can affiliate with and become involved with, because even though there's political action committees that have been set up to promote some of the corporate agendas, there actually are quite a few of these same organizations that have been set up to allow individuals to advocate for we the people. Whether it's the American Heritage Association or many. But I would also encourage people to do that, and to become involved with those and support some of those, and to learn about their agendas and what they're putting out there. But again, it kind of going back to sharing this video to family and friends, I think it's up to the individual also to share what they learn through their research, from the various sources that they can now access with family and friends. And I'll in my own personal life, I can just tell you, there's many examples where there are houses divided, and sometimes it's, what you say might not be falling on receptive ears. So we do have to learn to be gentle in our truth sharing, if you will. But yeah, those are just a couple of ways in my mind that I've seen the problem be dealt with.
You know, you made a really good point, and this is something that as I am looking and listening to um, talks and learning more about the effects of artificial intelligence, it is alarming um, at how the AI can actually not only generate fake news, right? But there are sites that are completely fake and they look real. And you think that you are looking at perhaps a group that is in alignment with your views. And for example, you go to a webinar on one of the platforms, and you watch the webinar and you're really impressed with the conversation and drawn in emotionally. Um, but that whole thing can be completely artificial intelligence created. They can create um, uh, individuals, organizations, they have whole websites that are completely fake and created by AI. And it is very difficult to discern that that's not even real.
Yeah, I mean,
So
it's absolutely terrifying, I think, if we really pay attention to where this whole AI thing can go. And it's definitely a two-edged sword, because there's so much positive that can come from this artificial intelligence, but then also how in the wrong hand of unethical users or developers, that they can literally create videos of people that are influencers that are not in fact at all true. I mean, it's not even what they said, and yet it looks exactly like it was what they said. So I think as we start to talk about regulations over the issue of AI, that people really need to educate themselves of the ways it can help and the ways that it can actually harm, us and our individual liberties. Just like the whole concept of media censorship, which I
Mhm.
know that's a huge issue. In fact, that came in even above the health issues when Americans are polled about their concerns of issues regarding the upcoming elections in November, that free speech and censorship is near the top of the list, right behind concerns about inflation in the economy. Uh, that Americans are worried that, if we're not allowed to access the truth, we're not able to hear both sides on the issues, even when it's uncomfortable, that that's foundational to a democracy, and that's foundational to our liberties and our freedoms. That
I
that we
agree.
were we were we were born with these rights. They come from our Creator. They're not granted by the Senate or the Congress or the Supreme Court or the President or the Vice President. Yeah. So yeah, that's a great point, Dr. Julie, that AI it's great. I mean, I'm actually using it more and more to help generate information and kind of to summarize things that I've known in the past, because I get information all the time just from multiple sources. Many of them nowadays are the internet, but then you kind of forget where you heard something, or what the
Mhm.
exact specific details of the statistics were. And that's one of the places, at least for me, that AI has been very useful. But then by the same token, we have to worry about these bots and all this fake news and fake
Yeah.
websites, that are
Yeah.
starting to pop up. So, Dr. Julie, I want to shift gears just a little bit and let's have a little discussion about the way that our agriculture and our ranching and our food production has changed. Let's just talk a little bit. I know that in previous discussions, you and I have talked about this a little bit.
Yeah. It seems like, so when we talk about the governing agencies that regulate how our food is produced, right? And what are their goals? And it seems as though we're seeing more efforts towards food scarcity, right? They seem to demonize certain foods and
I
wanting
mean, like
to
meat
shift people away from eating meat and eating just a vegetable, produce-based diet.
or even
Um,
insects.
and bugs. I mean, they want us to eat bugs, and so they do this using global warming as their background, right? So in Ireland, they had required the cattle ranchers to tag all of their animals with an electronic identification device, or otherwise known as an EID. And they were also monitoring the carbon dioxide put off by these animals and the various gases. There was research even measuring the amount of gases created by one cow's fart, right? I mean, pretty ridiculous. Um, but that is their background, right? So they're saying to protect against global warming, they forced those cattle ranchers to kill a lot of their cattle. I can't give you the exact number, um, but they had to kill those animals. They call it culling. Um, and they had mass burials of this meat. It did not enter the food chain for people or animals, right? Not entering into the food chain for dog food or anything like that. And so now in the United States, there is a bill that they are trying to force American cattle ranchers to tag all of their animals with these electronic identification devices. And that requirement is adding a huge cost burden to those cattle ranchers. Number one, it's an invasion of privacy. And um, the uh, cattle and bison ranchers are responsible for keeping food on Americans' tables, and this new rule would really significantly impact those farmers. So that is something that I think it is Harriet Hagman um, who is has this on her website. That's where I saw it. And she is bringing the attention to Congress, and I think they're working on voting against that requirement. So
This
that is a
runs,
huge
yeah,
effect.
this runs really deep, Dr. Julie. Again, we could probably spend hours just talking about these issues alone, revolving around our farmers and ranchers and the food that they can produce for us. I mean, I know I've seen a lot of stuff online in the last year about the farmers in France and in Holland, the Netherlands, actually organizing these big protests where they put their tractors out on the freeways and block the freeways because a lot of these smaller farmers and ranchers have been put out of business because of the regulations that have been brought by these governments, misguided governmental regulations in the name of saving the planet and saving our climate. And then they're basically just disappearing. And they've had enough. They've actually, they're fed up. But and I think it's going on in the United States as well. I mean, who better than our small family farmers and our small family ranchers are better able to help us have at the table sustenance that would contribute to our health and help us avoid these chronic illnesses that we're focusing on today. I mean, why is it that so much of the American farmland is being purchased now by small groups and even in some cases individuals? And we're beginning to come up with these mega farms and mega poultry feeding areas and major cattle feedlots where basically they're able to mass produce, and that in fact the yields are higher, the profits are better, but in point of fact the nutrition is suffering. We don't see the vitamins. We are actually seeing more of the toxic chemicals that they're using to come up with these ways of mass producing stuff that's bad for us, that's directly contributing to the epidemics of chronic illness. Um, yeah,
Yeah, they
again,
are.
there's got to be ways we can try to turn it around besides just educating ourselves and sharing the information that we learn.
Yeah.
It starts there for sure.
Definitely. With regard to the mass production. So they are actually making um, buildings where they are stacking the animals one on top of the other at different floors, kind of like think of an apartment building, right? I mean, they have different floors. So as the young animals start at the top and as they grow, they bring them down to the next level. Specifically, one example is the hogs, right? Um, and then once they reach the bottom floor, they're old enough and large enough to then go on to be processed. But what are these animals eating? These animals are eating highly processed foods. They're in high, dense populations. That is a health risk for those animals. So how are they combating the health risk to those animals in those densely populated environments? They're treating with vaccinations and antibiotics. They're giving them growth hormones. We are then consuming that meat. And so what we eat affects our health. So if the animals that we're eating are not healthy, we're not going to be healthy. You look at the recent recalls that we're seeing just in the last couple of weeks of people getting sick from, you know, I think one case was E. coli
Oh, the onion.
157, hemorrhagic E. coli over, they say the onions on burgers, but are we sure? Um, and then listeria was also found in some of the meat and processed already prepared foods that are sold throughout the whole country. So what do they have to do? We have to take all of that food out of the stores, creating again more food scarcity, right?
Higher
Uh,
prices.
and that's going to raise prices. Exactly. So I don't know. I don't know the real answer to that outside of um, growing your own food and knowing your local farmers and your local growers and really supporting them and supporting um, the smaller farms as opposed to these mass-produced companies. But uh,
Well, I think that
that
this is a good time to maybe put in a plug for the farmers markets that we're seeing more and
exactly.
more around in our communities. And again, getting to know the people that come to those farmers markets, the small farms and the small ranches that bring their products to those. And also, I know that I'm seeing a big increase in the number of farm to table restaurants, even that are in our
Mhm.
communities now, and people that are making a point to let us know that if you come to our restaurant to eat, you're going to get these foods that are coming from these small farmers and ranchers and are more organic and are raised with love and care by the people that know best, what's good for us and our health as Americans. Yeah.
Mhm. Yeah. You also mentioned who's buying up all of this farmland. It's not just those big animal producers. Big tech companies are purchasing up a lot of our prime farming land here in Wisconsin. And they're putting up these huge um, uh, solar panel fields of solar panels on prime farmland. So they're taking away, the resource to even just grow our own food.
Yeah, I've been to hear Robert Kennedy talk a couple of times, and I've watched quite a few of his presentations on alternative media through the social sites that I look at. And one of the things that he calls out frequently are a group of big organizations, including BlackRock. And BlackRock is one of these companies that if you look at the way their tentacles extend into the world today, it's really, really scary. I mean, I know there's Vanguard and State Street are a couple of the other ones that he talks about specifically by name. But yeah, that they're involved financially with these farms, with these tech companies. I mean, I think it's BlackRock that is in position to be the primary recipient of the dollars that eventually will be used to rebuild the infrastructure in Ukraine, if God willing, we can ever end the hostilities that are going on there. And certainly BlackRock is deeply involved with a lot of these investments related to the solar industry and issues around climate change and electronic vehicles and so many other ways. They're actually, BlackRock is even actually aggressively buying up a lot of our residential real estate around the country, because there seems to be this move on the part of the World Economic Forum and the United Nations And some of this you can read about in their Agenda 2030, which are published documents of where they want the world to be in another 5.5 years, relative to smart cities and things like the getting rid of our money so that everything is in the form of computerized digital currencies where they can actually be aware of every single one of our purchases and every single one of our sales, so that eventually, first of all, they can know that, but then second of all, there will evolve very likely ways to control that. I mean, if they don't want you, Dr. Julie, to eat more than one steak every quarter, one T-bone every quarter, one prime rib every quarter, then they just prevent you from being able to use your money, your income, the fruit of your labor to purchase more than what they deem appropriate. Yeah,
Exactly. Well, we certainly saw
it goes
that
pretty deep.
happen. We certainly saw that happen in Canada when they cut off the money to the truckers who were striking, right?
Yeah, that was shocking. And again, wasn't going to be anything you were going to hear about on the 5 o'clock news or the newspapers, but you had to find out about that other ways. Fortunately, it was brought to the attention of most of us, so that we could stand up and say, no, yeah, this is not right. But yeah, I think a lot of times I kind of look at what's going on in parts of England and Ireland and parts of Australia that unfortunately I think they are even worse off than we are as far as the powers that shouldn't be being able to limit their freedoms and their ability to share information. And a lot of times I've been led to understand that we here in the United States, because of our founding fathers and the brilliance that they had and the institution of our wonderful United States Constitution, that we are kind of considered around the world by this globalist agenda to be kind of the target. In other words, they kind of feel like we're not going to really be able to achieve all of our 2030 goals of our agenda as long as the United States still has their constitution and still has the freedoms and liberties that they still enjoy in the United States. So yeah, again, I would just like our viewers and listeners to be aware that we are that shining city on the hill, and that we are the model for much of the world. And that's why you see so many groups around the world stepping up and saying, God bless America, God bless what you guys are doing over there to try to maintain our God-given inalienable rights of freedom and liberty and choice and family and religion and culture and all those many things that we're still trying to stand for.
Yeah, yeah, exactly. Um, if I can just kind of ask you to elaborate a little bit, you bring up England and how they are subject to different social and economic um, changes that are more suppressive, for lack of a better word. What impact does corporate capture have on the health disparities among the different socioeconomic groups of our American population here?
Yeah, that's also an interesting thing to think about. Because there's two ways. I think you can look at it from two ways. First of all, I think there is this agenda to on the part of the leaders to try to create a certain amount of division between socioeconomic groups and even between racial groups, by basically emphasizing the fact that there are these inequalities of access to healthcare or access to jobs, access to loans, many ways that seems to be related to the fact that certain groups or certain races have historic advantages over others. And I mean, as me being a white male humanoid, it seems like in many ways I've seen white males be especially targeted as having certain aspects of us that are inherently racist, unfair, bigoted, prejudiced. Uh, there's all kinds of different terms you can put on it. But yeah, so there's that aspect. And I think a lot of that is being promoted by many of these three-letter agencies. Specifically, I would say the Department of Justice and the Department of State, particularly. But and then on the other side of the coin, I think we have seen historically that a lot of these allegations of disparities of access and care between groups, socioeconomic groups, I think it has existed. I think that there has been a lot of it's related to insurance and the way the medical system is funded, that there's a lot of potential for inadequate access, to many groups of Americans. And I think that's seen even on a larger scale globally. If we look at the care in countries in Africa or certain countries in Asia, that we can see that there's real limitations that's because of the way the system's set up. But yeah, I think, again, there's a lot that can be done about that on both sides to try to make it more equitable. But at the same time, I think we need to be aware that there is this agenda to create crisis, to create splits between groups. Uh, there's a there was a study, I want to say Cloward Piven, I think is the name of the two researchers that came out with it in the 60s. But they were talking about how to really change a country or a people. That one of the things that you had to do was you had to overstress the system and create so much crisis that literally virtually to the point of creating a revolution or a civil war. And that was the only real way that you could really see dramatic change among a group of people. And I do believe we are seeing, and even if you read the Agenda 2030 and some of the things that come out of the World Economic Forum and the World Health Organization and the United Nations, you can see that, creating rifts between groups, rich and poor, men and women, different races, different religions, Christians versus Muslims, that you can see that there are a lot of powers that shouldn't be, that are benefiting from these inequities and inequalities. And not to say that they don't exist or that they're not bad. I'm not saying that at all. I'm just saying, yes, let's try to fix them in ways that we can, but let's not use them as ways to create, violence and crisis when it doesn't necessarily have to be that way.
Yeah. Yeah. And again, the AI sneaks into there too. And so that feeds into their social media feeds, right? And the more they click on these, the more it feeds into those same algorithms and creating divisive thought, right? And that whole mindset for some of these people and driving anger and hatred, and it's divisive, and that's their goal.
Yeah. Well, we've covered a lot of ground today. I hope that we haven't just created angst among our viewers. I hope we've given people a degree of hope and inspiration. As we wrap up today, Dr. Julie, can you think of any other topics that you thought maybe we should touch on, or any other parting thoughts that you might have?
Um, well, I would, really like to encourage people to be aware. Um, Again, it's always easiest to focus on yourself, your family, and then the people you associate with. Where's your information coming from? Um, Being open to sharing opposing views and listen with a critical ear and fact checked the information that you're getting rather than just parroting um, information fact checked beforehand as best as possible. Stay in communication with your local governments and get involved at the grassroots level because I think that's ultimately where you feel you have the most power, right? When we look at turning this ship, sometimes it feels like it's going to take a tsunami to get it to change course. Um, but with everybody moving together in the same direction and holding our government officials accountable, that is going to make a difference in changing our course. Um, so yes,
Kind
so
of like
thank you.
in the fable or in the story of Gulliver's Travels, the way the little people were able to actually control him by everybody working together, with the same goals and agenda. But the other thing I would say that many of the things that we've talked about today, at the end of the day, they kind of boil down to the overarching concept of good versus evil. We've talked a lot about the almighty dollar and, following the money. But, with maybe our religious or theological caps on, I think it's worth saying here at the end that if you believe in a higher power, if you believe that there is a source of good in the universe, the force or God, Yahweh, Emmanuel, whatever you call that power, I do think that we have to realize at the end of the day that our Creator is omnipotent, and that at the end of the day, God wins. And I think there's a lot of times that for me it kind of boils down to that. And there's some days when I can say, nope, we're not gonna be able to change it. It's just too pervasive, it's too bad, it's too evil, it's too deep, it's too all encompassing. But then that's when I have to sit back and be quiet and say, God wins.
Agreed. Yes. When it looks like there's nothing we can do, um, I personally will step back and acknowledge that my God is in charge and everything is going to come out the way he plans for it to, for his own reasons, his own purpose. Everything happens in its own time for its own reason. We are all where we are meant to be at that time.
Yeah, amen to that. So, Dr. Julie, I want to thank you for your time and for your wisdom and the many things you've shared with us. And again, I want to just remind our viewers that this is one episode in a series. Please come back and watch some of the other content that we're going to be putting out with other experts. And be sure and comment and question and share it. And I just wish all of you a wonderful day.
Thank you, Dr. Taylor. I appreciate you inviting me on.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.